Greetings, everyone. We are back today, and today we are going to do things a little bit differently. Normally, I have a guest that I am interviewing, or I am answering questions about a topic myself. Today, in the spirit of Thanksgiving approaching, I thought I would share a few stories of gratitude. And I hope this inspires you to pause and think of some gratitude stories in your own life journey. My first story goes back to second grade. Now, this is a memorable experience because I had the chicken pox. And back in the day, we did not get vaccinated for chickenpox. So my sister got the chickenpox, and she's 3 years older than me, so she would have been in fifth grade. And my mom was so thankful that she got the chickenpox because there were some sixth graders who had experienced the chickenpox, and it was really, really bad. And the story is that at that time, people believed that the older you got, if you had not had chickenpox when you got it, it could be very, very dangerous. I don't know if that's actually true or not, but that is what my mom had said at the time. And so she wanted me to get the chickenpox. So she made me hang out with my sister and get the chickenpox on purpose. And so when I got them, I had them everywhere. And in fact, I still have like a scar above my eyebrow from where I had itched the chickenpox. But what I remember about the chickenpox and what I was so grateful for is, as uncomfortable as I was with all these little itchy areas, my mom got me this little teddy bear. And it wasn't that big. It was probably no bigger than the size of a ruler. And from head to toe of this bear, but it was a beige colored. It had a white cheeks, and it had a red little tongue, and it had a black nose made of string, and the strings were side by side by side. And over time, those strings kind of started to separate, so you could see the fleshy area or the white beige area of the teddy bear on the nose because the strings were separating. But what was really cool about this teddy bear is that it had a onesie pair of pajamas on it that was yellow and had these little red designs on it. And I just thought it was such a cool little teddy bear. And I didn't have a name for it. We just called it the chickenpox teddy bear because that is how it was brought into my life. And with that chickenpox teddy bear, I also had this little pillow that was green from a grandparent. I can't remember which one, but it had red roses on it. So it was this, what I would say, kind of an ugly color green, but it was unique. And then it had these red, bright roses on it. And then I had my baby blanket that had been through the wash so many times, and it was frayed. And it was a baby yellow color. So here I am with the chickenpox, very, very thankful that I had my chickenpox teddy bear with the yellow pajama set and my yellow baby blanket and this green pillow with these red rosebuds on it. And this was perfect because now my teddy bear had a little pillow and it had a little blanket that could lay next to me when I slept, and it could comfort me every time I wanted to scratch those chickenpox marks. I am so thankful for remembering that moment because it was my mom's heart, her heart of compassion, her heart of caring for me, her heart of nurturing me, and her gift of giving to me in a way that seems really small, but to a child in second grade who's very uncomfortable with the chicken pox, it meant a lot. And there were for years that I kept this little teddy bear, its pillow and its blanket with me in my bed. until probably high school age or college age. I can't remember when I stopped using it, but I think it was high school age because I think I gave this combination of three items to my pet, Mandy, who was a poodle terrier. And she was my dog that we ended up, unfortunately, um, we lost her when she was about 17, but that's a long life for a dog. But she took very good care of my teddy bear, my pillow, and my blanket. Another second story that I am very thankful for would have been in 2000. So I had graduated from physical therapy school and actually had been working for a couple of years as a physical therapist, but I was just kind of struggling on a personal level. And I was hanging out with okay people. My friends at work were great. I was working out and I was running, but I really didn't have like a nucleus of friends. I had kind of lost some of those when I graduated from undergraduate school and moved out of town and out of state to graduate school. And then when I moved back home, I lost my circle of friends again from graduate school. So I kind of felt like I was lost. Here I was, this physical therapist. I was in my career. I was happy about my career. But let's just say I kind of lost my identity a little bit. And I was living in an apartment by myself, and it was above my sister's apartment. And so I still had family connection and everything, but I was just a little bit lost as a 20-something new career professional. And my dad ran into a buddy of his from high school. His name was Larry Collins. And I am so thankful for Larry Collins and Carol Collins, his wife, because they reconnected with my parents and invited my parents to church, to their church. And my parents started attending church. Well, I was not a churchgoer. I was not a Christian. I kind of waffled even in the belief of Christianity at the time. And here I was being asked by my dad as a gift for Father's Day to come to church. And I really wasn't happy about it. I really didn't want to do that. And here I was on Father's Day sitting in the church because I loved my dad, and that was what he wanted for Father's Day, was for the whole family to go to church and then to go to lunch afterwards. Well, here I am sitting in the church, and I couldn't believe it, but the Minister Dick Alexander, was talking about identity. I couldn't believe it. It really resonated with me. And so let's just flash forward a few months. I went to church every day, or every week, every Sunday, and I was baptized Labor Day weekend of 2000. So here I am in the spring of 2000, not even thinking about going to church. And my dad's invitation is extended to me. And out of love for my dad and out of respect for my dad, I attend church and they talk about identity. It was unbelievable. And so I'm very, very thankful for Larry and Carol Collins for inviting my parents to church in the spring of 2000. And I'm very excited that my dad invited me to church on Father's Day of 2000. And I'm even more excited that of what happened between Father's Day and Labor Day, because a lot of who I was and who I am even today and the growth that I've had really started in that summer of 2000. And I'm so thankful to be able to have a relationship with Jesus Christ and to have a church family, especially living in a different state than my family. So I'm in Wisconsin now. My family's back in Ohio, but I have a lot of church family here in the state and in this area. And I'm super excited and thankful for the church family who has walked alongside my family since we moved here in 2012, and really are an extension of our family now. Without that invitation in June of 2000, I would be completely in a different place potentially than I am here now in 2019. My final story that I'm going to share with you of gratitude is my colleague Rhoda Farr. I came to know Rhoda Farr, I believe it was in 2005, maybe 2004. And we didn't really know each other well at that time. We worked together. We worked in the same facility, but let's just be frank. There were 40 staff members in this physical therapy clinic, and there was just a lot of personalities, and we sat on the opposite side of a barrier, I should say. It wasn't a cubicle or anything like that, but it was like a cubicle wall. And so I didn't really converse a lot with Rhoda in particular during that time. And then I became the supervisor of that clinic and started to get to know more of the staff personally as their boss. And then for circumstances that happened, that group split, and some of the therapists stayed with the physician's office that was starting their own physician-owned physical therapy practice. And some of the therapists stayed with the hospital group that I was working with. And I actually ended up launching another clinic in another area with that hospital system. And Rhoda Farr came and to work for me as I was going to be the supervisor. She came to work as a senior physical therapist, senior meaning a role position, not necessarily age. And we became very, very close as colleagues and as friends. And so flash forward 2009, she starts treating a lot of neck and headache and migraine situations with patients. And I was fascinated by it. And she really took me under her wing. Now, here I am, I'm her supervisor, but she took me under her wing to teach me how to treat patients with headaches and migraines. And then a couple of years later, she invited me to an educational course about treating the inner ear. And because she invited me and because she had the gift of generosity and sharing information with me and wanting to teach me, I am very, very thankful for that. At that point in time, I was I would have been 11 years into 14 years into my career when she was teaching me. And I'm super grateful for that because she had 2 or 3 decades of experience as a physical therapist. So she had a wealth of information, and I was a sponge because she was the type of therapist, still is the type of therapist, that just thinks out of the box. She looks for the root cause of the problem. She's not afraid to try really anything that's going to help her patients be better. And it really made me grow as a physical therapist. So when I look back, I'm so appreciative because since I met her, I had sometimes had experienced headaches. I don't think I get migraines. I get some really intense headaches. But since knowing her and since knowing what I learned from the course that she invited me to, during that particular year, I learned so much about how to treat patients with headaches and migraines and vestibular or inner ear balance issues that it really changed the way I treated everyone because of the questioning process, the listening process, really understanding what the patient was experiencing and is experiencing. It really allowed me to connect more with my patients. And I am forever grateful for just those tips that she taught me. But that course on the inner ear really has changed my life because I get vertigo. I get something called BPPV, or benign proximal positional vertigo. And when that happens, like the toilet bowl is my best friend. I am so off balance that I am vomiting. And that course that she invited me to taught me how to treat myself so that I don't have to suffer. And in turn, I have been able to treat other patients so that they aren't suffering. I've helped change people's lives drastically where they were walking around for months feeling off, feeling fuzzy, feeling like they're in a well, feeling like they can't function because they can't drive. They can't even scan items on a shelf in the grocery line without getting dizzy. And I've been there. I know what that feels like. I know what it feels like to look out and your brain and your vision aren't connecting. So what you see is like a house of mirrors. You can't even tell where the floor and the wall start and end. That is how off balance I have been, and I know my patients have been. But because of Rhoda Farr, she taught me how to treat patients with these issues, and she invited me to learn more. And because of that, I am so much a better therapist because of her. Now, there are other physical therapists, there are other physical therapy assistants that taught me. There are massage therapists who have taught me, and there are athletic trainers who have taught me. But I could go on and on and on about everyone I am grateful for. But today, I'm grateful for my mom who gave me a chickenpox teddy bear and comforted me. I am grateful for my dad who invited me to church so that I could rediscover my identity and my relationship with Jesus Christ. And I am grateful for Rhoda Farr, who changed how I treat patients and why, and is one of the reasons I am a successful physical therapist and getting results with my patients. Thank you so much for spending time with me today. I hope that you take a pause and think of some of the gratitude stories in your own life. And then I also encourage you to reach out to those people who have influenced you and who you are most grateful for. Until the next time, be bold, be beautiful, and be you.